Okay, well, I am Amanda, as you heard earlier. That's for the next person. Okay. We are going to talk for a minute about CISBEL. Does anybody know what CISBEL is? Wendy does, yay. Okay, so that's why we're going to talk about it, because it's important, and I think it has ramifications for you and your students, and so it's really important that you know what it is and what's coming. Ken, you want to introduce yourself?
Thank you, Ann. My name's Ken Johnson, and I'm one of the co-directors of CISBEL, and I'm delighted to work with Ann, who has recently joined us, and we've been trying to put this project and center together, and we'd like to tell you a little bit about that.
Okay, so I do want to acknowledge from the start my friend and colleague Maddie Lachey, who was a huge part of getting this going several years ago now already. It's been in the works for a while, so yeah, let's talk about it. So this is what it stands for. It's a big acronym. We like those, right? So the idea here is to create this center for simulation versus all of the parts and pieces that we kind of have at this point. So this is what's coming, right? That's the new med school, the Eccles, what's the name of it so I get it right? Spencer Eccles Fox Medical School. School of Medicine. Sorry, you should have done that. This is a schematic of what it's going to look like on levels, and you can see in the bottom right there is where this beautiful new simulation center is going to live. So the impetus here is that we have several places where we do simulation on Health Sciences campus. They are somewhat scattered and they are not necessarily accessible to everyone. So the idea here is, as we develop this beautiful new learning space, that we have a center that's going to be more accessible to everyone. So whether or not you think that you teach with simulation at this point, whatever that means to you, we're here to tell you that there are lots of different ways to do simulation, and this is going to be a great resource for everyone. So can you add something about history? I don't know why we're doing this.
Sure. Yeah, I'll jump right in. Thanks, Ann.
Please do.
So, as you may be aware, there's a lot of experiential learning opportunities throughout the throughout University of Utah Health. And most of them, or pretty much all of them, are, for the most part, relatively siloed. They have their own funding line, they have their own people, they have their own thing that they do. You may also be interested to know that if you're running some sort of simulation program, it requires a fat wallet. It is expensive. And the first thing you realize is, wow, there's probably an economy of scale, and I'm not there when you're trying to pull off your experiential learning activity. So one of the ideas was, well, we've got all these bright people doing a lot of great work in the realms of simulation and other types of experiential learning. And I bet they have a lot of great ideas, and I bet they're like me, feeling the pinch. Why don't we see if we can pull us all together and collaborate, share our intelligence, and maybe find that economy of scale. So I think that was the backdrop within which CISBEL was born. We owe it a lot of that gathering process to Wendy here, who put us all in a room and said, all right, you guys start talking to each other. Hence, CISBEL was born.
Okay. So that slide didn't work out so well. That's interesting. Okay, well, that is the goal here, though, is to increase access for everyone. The idea is for it to be multidisciplinary, interprofessional. Sorry, that's Gracie over there if you haven't met her. So that it is available to all of the hospitals, clinics, or not hospitals, the clinics, the colleges and schools on health sciences, and hopefully expanding that even further as we go along. The primary aim is to increase access and reduce the cost for everyone overall. So if you are in a college or program right now that doesn't really have access to simulation, or the simulation center, or standardized patients, or whatever that experiential learning is, the idea is that the center will have those physical facilities, but also the expertise and the people who can help you with those things. Mentioned standardized or simulated patients. We have a couple of programs. We have a program within the College of Nursing, and we have a program within the health skills, the medical skills, clinical lab, clinical skills lab, sorry, in EHSEB. And hopefully by combining some of those things, we can make them more available to people and improve the quality of our programs as well. We have specific simulation educators within the College of Nursing, and we're happy to share that expertise with others, but we don't really at the moment have a way to do that. So that's part of what we're here for today, is to talk about what might be available. If you're thinking about, we're doing a workshop this afternoon about in-class, large group, in-class simulation. So we have those resources as well. Hopefully if we all share everything, then it's not going to be so expensive for everyone, and we can share resources. You want to talk about leadership?
Sure.
We haven't rehearsed this, can you tell?
Thank you, Ann. So this is an abbreviated org chart, if you will, that describes what we'd like to do in terms of the leadership for CISBEL. So we're under the direction of the Senior Vice President and the Associate Vice President for Education. They are well aware of all things CISBEL, and we're in the process of convening a CISBEL board, and its purpose will be to provide sustainability in terms of leadership and in terms of fiscal sustainability. And where Ann and I kick in is at the steering committee level. And we have a wonderful group of people who have joined our steering committee. It's made up of people across all the 6 colleges and schools within University Health. And if you're interested and would like to be a part of that steering committee, please reach out to Ann or myself, and we'll get you invited to the Zoom. We meet once a month. And this has been a great clearinghouse of ideas on how to make experiential learning better. To be honest, we've been a little bit sidetracked with just figuring out where the plugs and tables and lights go in the new sim space, and have devoted a fair amount of effort working with the architects. Actually, that's been a very big learning experience for me, and understanding the level of detail that is required to build a facility like that. And I've been brought along, I've learned a lot, and I've really come to appreciate this can be one cool space once it's put together. And a lot of people have contributed to that, so looking forward to that. But back to our steering committee. We have a steering committee, we meet, we discuss how we can make things better for experiential learning in our health sciences campus. The other thing that has come out of that steering committee is I've realized there's a lot of really dynamo people who have a lot of knowledge in experiential learning. Way more than I have, and it's they elevate our game. They'll say things. Have you thought about this? Or why don't you use that? And how are you going to accomplish that exactly? And so we felt that one of the big wins for CISBEL would be to tap into that intellectual prowess, if you will, to make simulation better everywhere. From there, we have a division roundtable. And right now, our division roundtable consists of these 4 entities that we have that we believe we have direct oversight over, and they are in situ simulation, immersive simulation, procedural simulation, and simulators actors. And let me just describe what those are for just a brief minute. Start with in situ simulation. This has been a growing book of business, if you will, in our health sciences campus. A lot of it is grassroots. A lot of it's been adverse event driven. Hey, we want to relive that bad thing that happened. And we want everybody that was involved in that space to be there. And we want to do it often enough so all the people that work in that space see that problem. And so that's been a lot of fun. It's been so far kind of hard to fund, but it hits the spot. Another one is our immersive simulation division. That's where Ann and I kick in, and probably others throughout. We run these simulation centers. And we try to mimic clinical environments and control things as much as we can so learners have a consistent learning experience. And they're usually organized courses where you come in and address a particular topic and have at it. Simulated actors, this is an emerging piece in all healthcare. Getting people to be either a patient, a doctor, a family member, a nurse, or just anybody else you might encounter in a healthcare setting, and having people learn how to interact. Communication and professionalism is a big deal, and really amps up the realism of an experiential learning experience. It also is emerging as a tool to evaluate people. Just in my little world, in anesthesia, the American Board of Anesthesiology has adopted the use of standardized actors in observed structural clinical exams, or OSCEs, for part of the initial board certification, all zeroing in on professionalism and communication. Finally, procedural simulation. This is another emerging space. We got a lot of robots, and they're growing in number. And other kinds of very precise tasks that need training before you actually do it in a real patient. So this is a great space. And so this makes up our 4 divisions of CISBEL. We also want to strengthen our affiliations with VRXR and also our cadaveric lab folks who do a lot of similar work. I think that's a wrap up on that topic.
Okay, I think we're just about there. Let's see. Okay, yep, to wrap it up, so it is all about experiential learning. That our keynote this morning, our first TED Talk, this is where we need to be with our students, right? Of course there's tons of content that they need to learn, but the competency-based education, all the competencies that we need to be checking on students before we let them out of here. Hopefully prepare them for practice so there's not so many big surprises once they get out there. That's kind of what this center, the idea behind this center is. That's why it's in the name. It's about experiential learning. Yes, simulation, but there's also so many other things. Again, centralizing resources, combining expertise, so it's raising the quality for everyone, promoting scholarly work, innovation, all these great ideas that everybody has. Hopefully the idea is that this is going to provide a place for all of that to happen. We are working on, there's a whole process of establishing this as a center, so there's paperwork and things that go along with that. So we're working on that at the moment, figuring out how to make this equitable for everyone and how to sustain it financially. Obviously, those are huge, big challenges that we have. So we're excited for this. This is a great opportunity. I feel really lucky to be able to work on this. As Ken said, developing, it feels like a huge responsibility when you're talking about where the plugs go and where all the things are going to go in the center. But what a great opportunity for collaboration and innovation and all of that. You have any final words?
Thanks for listening.
Yeah, thank you.